Welcome to The Explainer. Today, we are tackling something that a lot of people experience. That feeling, that sensation of your own lungs just squeezing shut. We're going to break down what asthma is, what it really feels like, and what's happening inside your body.
Yeah, for a lot of people with asthma, that's exactly what an attack feels like. It's this intense tightening, from the inside out. So we're calling it the asthma squeeze. And that's what we're going to follow today. What causes this squeeze? How do you know you have it? And most importantly, how do you find that release?
All right, so let's dive right in. To really get a handle on that squeeze, we've got to go inside the lungs, inside the airways themselves, and see what is actually going on to cause that really terrifying feeling of not being able to get a breath.
So, when you boil it all down, asthma is really about your airways getting blocked up. But here's the thing that might surprise you. The big problem isn't getting air in, it's getting air out. The pipes, so to speak, get so narrow that air gets stuck inside your lungs. And that, right there, is the real root of the problem.
Okay, so how does this all kick off? Well, it starts with a trigger. Your body's immune system just overreacts. It unleashes this flood of chemicals. You've probably heard of histamines. There are also things called leukotrienes. And you can just think of them as the body's alarm bells going haywire. And this triggers a nasty 1-2 punch. First, the walls of your airways swell up. Then the muscles wrapped around them squeeze down, hard. What you're left with is this super narrow passageway, and that's what leads to that horrible trapped air feeling.
And you know that classic wheezing sound you associate with asthma? Well, what's so interesting is that it's literally the sound of air struggling to get out through those squeezed-shut tubes. It's fighting its way out. This whole phenomenon of air trapping, doctors have a fancy term for it, dynamic hyperinflation. That's what causes the intense shortness of breath.
Okay, so that's what's happening. But why? Right? What are the everyday things that can actually set off this whole chain reaction? Let's take a look at some of the usual suspects.
Honestly, the list of things that can trigger an attack is kind of staggering. It can be stuff in the air around you, pollen, dust, you name it. It can be something as simple as the common cold, but what really gets me is that it can even be medications you're taking for something completely different. And get this, even something good for you, like exercise, can kick off an attack if you're breathing in cold, dry air. And this is just a wild example of how connected everything in our body is. For certain people, taking a simple aspirin can start this bizarre cascade of events. See, the aspirin blocks one chemical pathway, which forces the body to go into overdrive, producing a ton of those alarm bell chemicals we talked about, the leukotrienes. And what do? They make the airways squeeze shut. Just incredible.
All right, so if someone walks into a doctor's office with these kinds of symptoms, how do they figure out if it's really asthma and not something else? Let's get into how they actually diagnose it.
The main tool in their toolkit is something called a pulmonary function test, or PFT for short. It's basically a series of breathing tests. And the goal here isn't just to see, yep, breathing is hard. They're looking for a very, very specific signature, signs of a blocked airway that is, and this is the key, is also reversible.
So doctors are on the hunt for two big clues. First, they measure what's called the FEV1/FVC ratio. Now that sounds complicated, but all it really means is they're comparing how much air you can blast out in 1 second to the total amount of air you can breathe out. If that ratio is low, it points to a blockage. But that's not the whole story. The real smoking gun is what happens next, after the patient takes a puff from a rescue inhaler.
And this right here, this is the magic number. If that FEV1, the amount of air they can force out in that first second, improves by more than 12% after just one puff from an inhaler, well, there's your diagnosis. It means the blockage isn't permanent, it's reversible. And that, my friends, is the classic calling part of asthma.
Okay, now for what's arguably the most important part. We've talked a lot about the squeeze, so now let's talk about the release. How do we treat asthma? How do we manage it so people can go on to live totally full lives?
The first thing to know is that treatment is definitely not one size fits all. It's what's called a stepwise approach. Basically, doctors tailor the treatment to match how bad and how frequent your symptoms are. So, for someone who only has symptoms once in a blue moon, a simple rescue inhaler might be all they need. But as things get more persistent, that's when you start adding in daily medications to keep things under control.
And this is a really crucial distinction. There are two totally different types of medications. You've got your relievers. Those are the rescue inhalers. They give you that quick, immediate release by forcing the airway muscles to relax. But then you have the controllers.
These are usually inhaled corticosteroids, and they work behind the scenes over time to fight the actual inflammation that's causing the problem in the first place. Their job is to prevent the squeeze from even starting.
But what happens when the normal treatments just aren't cutting it, when that squeeze turns into a full-blown medical emergency? Well, that's called an asthma exacerbation, and frankly, it can be really, really dangerous.
You can actually track the danger by looking at a patient's blood. It tells this incredibly urgent story. So early on in a bad attack, a person is breathing so fast that they're blowing off too much carbon dioxide. But then comes the really scary part, the paradox. As they get exhausted from the work of breathing, their CO2 levels might actually start to look normal. This is not a good sign. It's a huge red flag that their body is starting to give out. And finally, when they can't keep up anymore, that CO2 builds up, and it throws their entire body chemistry into a dangerous acidic state.
When things get really bad, you're looking at two major, life-threatening complications. First, the muscles you use to breathe can just get exhausted. They've been fighting so hard for so long, they just stop. That's respiratory failure. You just can't get oxygen in or CO2 out anymore. And second, all that pressure from the trapped air can get so high that it can actually pop one of the tiny air sacs in the lung. That leads to a pneumothorax, which is a collapsed lung.
So is there a cure? Not yet, but our understanding of what's going on has never been better. And that's the key, because we get the mechanics of the squeeze, the inflammation, the muscle tightening. We've been able to develop incredibly targeted treatments that provide both that quick release and long-term control. And because of that, medicine has really transformed asthma. For most people, it's gone from being this debilitating disease to a chronic condition that can be managed. This whole journey, from understanding the squeeze to mastering the release, it's really an amazing story of modern medicine.